I did only 6 isometric exercises every day. My muscles got stronger, my circulation improved, and my pain disappeared. A study published in the Journal of Aging Research found that after the age of 50, muscle loss is the main cause of chronic pain, poor circulation, and falls. And it makes sense. Weak muscles overload the joints, compress the spine, and make it harder for blood to return through the veins, creating a cycle of pain and immobility that gets worse over time. And the worst part, trying to reverse this at a gym is no easy task. If your joints are already overloaded, traditional weightlifting exercises become even more aggressive. Imagine someone with knee pain trying to do a squat that will almost certainly end up in their training program, given that the trainer has 1,000 clients to manage and won't have time to address your individual needs. That's why today you'll see 6 isometric exercises that reverse this process, strengthening muscles, improving circulation, and eliminating pain without aggravating joints that have already been damaged. Before we begin, please tell us in the comments your name and the city you're watching from. We'd love to know. Exercise number 6, isometric dead bug. The isometric dead bug gets its name because the position you assume resembles an insect lying on its back with its little legs in the air. It is a fundamental exercise for core stability, used in both rehabilitation programs and by high-performance athletes, and is considered one of the best movements for protecting the lower back over the long term. The muscles it works most intensely are the transverse abdominis, which is the deepest layer of the abdominal muscles and acts as a natural belt around the spine, the multifidus, which are small but powerful vertebral stabilizers, and the hip flexors. A study from the British Journal of Sports Medicine indicated that core stability exercises like the dead bug can reduce the incidence of lower back pain by up to 45% in at-risk populations. Can you imagine the impact of that on your daily life? To perform it correctly, lie on your back on the floor, raise both arms pointing toward the ceiling, and keep your knees bent at 90 degrees in the air. Hold this position by strongly contracting your abs and pressing your lower back completely flat against the floor. The challenge lies precisely in not moving, resisting gravity with total control. An important tip: imagine you're trying to crush a piece of paper placed under your back. That conscious activation is what separates those who truly do the exercise from those who simply endure the position. The main mistakes to avoid are letting the lower back arch upward, holding your breath during the contraction, and allowing the hips to sway from side to side. If the lower back lifts off the floor, the exercise loses much of its effectiveness and ends up overloading the very region it should be protecting. For beginners, it is recommended to start with 3 sets of 20 seconds. For more advanced practitioners, 3 sets of 45 seconds already represent a considerable stimulus. People with a herniated disc in the acute phase should consult a physiotherapist before starting, although for most chronic conditions, this is precisely one of the exercises recommended during recovery. Exercise number 5, isometric Superman. If the dead bug works the front of the body, the isometric Superman takes care of the back, and that relationship is no coincidence. The posterior chain is frequently neglected compared to the anterior chain, which creates muscular imbalances that translate into pain, poor posture, and an elevated risk of injury. The name of the exercise comes from the position that resembles the superhero flying, with arms extended forward and the body suspended in the air. It focuses on the entire posterior chain of the body, the erector spinae, which are the muscles responsible for keeping the spine upright, the gluteus maximus, the posterior deltoids, and the lower back. Physiotherapists frequently prescribe it for patients with back pain complaints precisely because it strengthens the deep spinal muscles in a progressive and safe way, with no impact and no external load. In addition, regular practitioners of this exercise notice visible improvements in posture over the weeks, with the torso naturally more upright and the shoulders better aligned. To perform it, lie face down on the floor with your arms extended above your head. Then, simultaneously raise your arms, chest, and legs a few inches off the floor, keeping your gaze directed downward. The head should be in line with the spine. Hold this position with your glutes contracted and your back muscles activated throughout the entire set. The secret is in feeling the contraction distributed along the entire spine, not concentrated in just one point. The most common mistakes are using momentum to rise instead of controlling the movement, lifting the limbs too high to the point of causing excessive compression in the lower back, and releasing the glutes during the hold. Lifting the limbs too high is counterintuitive. The higher you go, the greater the spinal compression and the lower the muscular benefit. A few inches off the floor is sufficient and far more effective. For beginners, 3 sets of 15 to 20 seconds will already bring significant adaptations. For those with some conditioning, 3 3 sets of 30 to 45 seconds represent a considerable challenge. People with severe hyperlordosis or acute lower back pain should exercise caution and seek professional guidance before including this exercise in their routine. Exercise number 4, isometric calf raise. There is a muscle in your body that many specialists call the second heart. We're not talking about any sophisticated trunk muscle. We're talking about the calves. This muscle has the fundamental function of pumping blood back to the heart against the force of gravity, and when it is weak, venous return is compromised, causing a feeling of heaviness in the legs, swelling, and over time, circulatory problems that go far beyond aesthetics. The isometric calf raise works the gastrocnemius and soleus intensely, which are the two main muscle portions of this region. Unlike the dynamic version, where you repeatedly rise and lower, the isometric version holds the contraction at the point of greatest tension, which is at the top of the movement, maximizing muscle recruitment and time under tension. To perform it, simply rise onto the balls of your feet and hold that position for the determined time. To increase the range of motion and muscle activation, perform the exercise on a step, letting your heels hang slightly before rising onto the balls of your feet. A bonus tip: vary the position of your feet across sets, alternating between parallel, slightly open, and slightly closed, ensuring that all portions of the calf muscles are recruited. It is a muscle predominantly composed of slow twitch fibers, which is why it responds very well to longer duration sets. Strong calves are also essential for balance and ankle stability, which is directly linked to fall prevention, especially after age 50. The main mistake to avoid is letting the ankles roll outward during the contraction, which shifts the work to structures that should not be overloaded. The ankles should remain aligned with the knees throughout the entire exercise. For beginners, it is recommended to start with 3 sets of 30 seconds. For those with more conditioning, 3 sets of 60 seconds represent an excellent stimulus. People with acute Achilles tendon injuries should avoid the exercise until cleared by a doctor. Before we continue, don't forget to subscribe to the channel and turn on the notification bell. Having constant access to science-based information is what will help you progress with health over the long term in the world of exercise. Exercise number 3, isometric push-up hold at the top. The push-up is one of the most complete exercises that exist, and its isometric version takes that level of complexity to a place most people never imagine. The concept underlying this exercise is called neuromuscular stability. When you hold a static position under load, the central nervous system is forced to recruit a much greater number of motor units than in a common dynamic movement. The result is a simultaneous improvement in strength, coordination, and muscular endurance. The muscles worked are the pectorals, the anterior deltoids, the triceps, the entire core, and the glutes, which need to be contracted to keep the body in a straight line. This simultaneous activation of multiple muscle groups makes the isometric push-up a full-body exercise disguised as a chest exercise. A study published in the Journal of Hypertension demonstrated that isometric exercises like this one can reduce blood pressure in a manner comparable to aerobic exercise, making it a valuable alternative for those with limitations that prevent them from running or cycling. To perform it, position yourself exactly as in a traditional push-up, with your hands placed on the floor at shoulder width and your body in a straight line from head to heels. Then lower yourself until your elbows are at 90 degrees and hold that position. Your glutes should be contracted, your core activated, and your head in line with your spine. You'll know you're doing it right when you feel a controlled tremor in the muscles after a few seconds, which is a sign of intense recruitment. The main mistakes to avoid are letting the hips drop toward the floor, raising the hips too high to form an inverted V shape, letting the elbows flare too far out to the sides, and above all, holding your breath. Controlled breathing during isometric exercises is not just a matter of comfort. It directly influences blood pressure during exertion. For beginners, 3 sets of 20 seconds are a great starting point. For more advanced levels, 3 sets of 45 to 60 seconds represent a real challenge. People with injuries to the wrist, elbow, or shoulder should adapt the support position or seek guidance before starting. Exercise number 2, warrior pose. Originating from yoga, the warrior pose carries a philosophy in its name, strength that comes not only from the muscles, but also from the mind, and that is not just poetry. This isometric exercise is widely recognized for simultaneously developing muscular strength, mental focus, balance, and body awareness, and is practiced by athletes across various disciplines who seek to improve their proprioception. From a physical standpoint, it is a truly complete exercise. It works the quadriceps, gluteus maximus, hip abductors, core, and deltoids all at the same time. The gluteus maximus, it is worth noting, is the largest muscle in the human body, and having this muscle well developed developed, creates a positive cascading effect on metabolism, pelvic stability, and lower back protection. When this muscle is weak, the pelvis tends to tilt forward, increasing the lumbar curve and generating that back pain that seems to have no apparent cause. To perform it, step 1 foot forward, bending the knee to 90 degrees, keep the back leg extended with the heel firmly on the floor, and raise your arms above your head or open them to the sides with your shoulders relaxed. The torso should be upright, your gaze fixed forward, and your hips facing forward, not rotated to the side. The isometric challenge lies in keeping the hips low and the front knee directly over the ankle without passing the line of the toes. The natural tendency is to let the hips rise as the seconds pass, which relieves muscular tension but eliminates the stimulus. What makes this exercise particularly valuable for those seeking circulatory improvement is that the prolonged contraction of the large muscle groups of the legs actively stimulates venous return, working in synergy with the second heart of the calves mentioned earlier. The most common mistakes are letting the front knee collapse inward, leaning the torso forward, and releasing the arms before the time is up. For beginners, 3 sets of 20 seconds per side are sufficient to feel the exercise. For more advanced levels, 3 sets of 45 seconds per side represent a considerable muscular and mental challenge. People with knee or ankle injuries should reduce the depth of the movement or consult a professional before starting. Exercise number 1, prayer press. The prayer press can be done virtually anywhere, even seated in a chair or standing in a bank line, and still generates a surprisingly intense muscular activation. Its name comes from the prayer position, with the palms of the hands pressed together at chest height. The exercise primarily works the pectoralis major and the anterior deltoids, but when performed standing with the core activated, it also recruits the stabilizing muscles of the abdomen and shoulders. An interesting characteristic of the prayer press is that the intensity of the stimulus is directly proportional to the force you apply. The greater the pressure between the hands, the greater the recruitment of the pectoral muscle fibers. According to the study by Snyder and Fry, published in 2012, maximal isometric contractions significantly recruit type 2 fibers, which are the primary drivers of muscle hypertrophy. This means that a seemingly simple exercise, performed with the correct intensity, can generate real muscular adaptations. To perform it, press your palms together at chest height with your fingers pointing upward, as in the prayer position. Then, press one palm against the other with as much force as you can and hold that tension statically for the determined time. The elbows can be slightly elevated to increase recruitment of the upper chest. Keep your shoulders away from your ears throughout the entire contraction, avoiding elevation of the shoulder girdle. The most common mistake is holding your breath during the contraction, which not only reduces the efficiency of the exercise, but can also cause an undesirable increase in blood pressure. Breathe in a controlled manner, ideally exhaling slowly during the phase of greatest effort. Another frequent mistake is not applying real maximum force, performing the exercise superficially without reaching the activation threshold necessary for an effective stimulus. For beginners, 3 sets of 20 seconds with 30 seconds of rest between them are a good starting point. For those already more familiar with the exercise, 3 sets of 45 seconds with the intention of maximum pressure will bring visible results. There are no significant contraindications for this exercise, but people with shoulder injuries should observe whether they feel pain during execution, and if so, stop and seek evaluation. Now that you've seen all 6 isometric exercises in the program, it's time to introduce a special bonus. Bonus exercise: dead hang. The dead hang is the act of hanging from a bar with your arms extended above your head and holding that position for the determined time. Apparently simple, but extremely powerful for those seeking to restore spinal health, improve posture, and strengthen the upper posterior chain. From a muscular standpoint, the exercise intensely recruits the fingers, forearms, biceps, all the muscles of the back, and the scapular stabilizers. Grip strength is one of the most reliable indicators of longevity, according to various medical studies. A study published in The Lancet with more than 140,000 participants showed that grip strength is a predictor of death from cardiovascular causes as accurate as blood pressure. Strengthening the forearms and hands is not just a matter of aesthetics, it is literally a matter of life. But the benefit most relevant to the context of this video is spinal decompression. When you hang from a bar, gravity works in your favor for the first time all day. Throughout our entire lives, standing or sitting, the weight of the body compresses the intervertebral discs. The dead hang temporarily reverses this process, creating natural traction between the vertebrae, relieving pressure on the discs and the nerves that exit the spine. Studies indicate that this decompression can temporarily increase increase height by up to 3 inches right after the practice, which is clear evidence that the spine was under compression and has been relieved. Beyond the spine, the dead hang promotes realignment of the shoulders, counteracting the rounded posture we spend the day building in front of the computer. The scapular stabilizers are placed in a position of active lengthening, gradually opening the chest and returning the shoulders to their correct position. In the context of circulatory improvement, the lengthening of the tissues around the blood vessels in the shoulder region can significantly improve blood flow to the upper limbs. To perform it correctly, grip a fixed bar with your hands at shoulder width or slightly wider, and simply let your body hang with your arms fully extended. Do not hang passively. Gently pull your shoulders down and back as if you were trying to tuck your shoulder blades into your back pockets. This minimal activation protects the shoulder joints and ensures you are using the right muscles instead of placing all the tension on the ligaments. The main mistakes to avoid are letting the shoulders rise up toward the ears instead of keeping them pulled down, holding your breath during the exercise, and stepping off the bar with unnecessary impact at the end of the set. A more subtle but equally harmful mistake is using a grip that causes the wrists to bend excessively to the sides, which over time can lead to tendinitis. Always prefer a neutral grip or with slight pronation, with the wrists aligned with the forearms. For beginners, 3 sets of 20 to 30 seconds with 60 seconds of rest between them are a safe and effective starting point. For more advanced practitioners, 3 sets of 60 seconds or more represent a real challenge for both grip strength and back muscle endurance. If you do not have access to a bar, it is possible to use a reinforced door frame, but make sure it can support your weight safely before hanging from it. People with a rotator cuff injury, acute shoulder impingement syndrome, or shoulder instability should consult a physiotherapist before including the dead hang in their routine, as the traction position may be contraindicated depending on the specific condition. If you enjoyed this and want to discover another exercise widely practiced in communities across Asia to undo years of neglect toward the body, we have a video appearing on screen right now showing each of them in more detail. Don't miss it. Thank you for watching all the way through, and God bless you, my friend.